Hello, thank you for joining us today for this Serious Animal Disease Awareness webinar. This is an introduction to our popular in-person workshop series that has been sidetracked due to COVID travel restrictions. I am Mickey Shatosky, co-manager for the Animal Health Emergency Management Project. This webinar is part of the AHEM suite of resources for Canada's livestock producers and industry association staff. The AHEM project objectives are to provide you with awareness of some of the new emergency preparedness tools that are built for industry, by industry, with both levels of government. We have never had this level of collaboration before. Understanding of how the tools are used and applied in the event of an animal disease outbreak. For example, the producer handbooks and industry association plans outline the roles and responsibilities of all those involved, including producers in preparing for and responding to an outbreak. Remember, you are not responsible for everything during an emergency event. However, for an effective response, you do need to know where you fit. If you are aware of the tools and understand how to use them, we as an industry have more capacity to respond to the event. This will result in a more sustainable industry when it comes to dealing with our biggest vulnerability, a serious animal disease outbreak. Also note that although our resources are built around animal disease outbreaks, the emergency guidance in the AHEM resources are also applicable to other unanticipated events, such as fire, flood, or a power grid failure, for example. Here we see the AHEM team and the areas in which we work. Matt Taylor and I are project managers. I am also the lead on Activity 4 training. Bob Burton leads protocol development. Todd Bergen-Henningowen leads resource development, which includes the national frameworks, association plans, and producer handbooks. Gina Teal leads awareness, which includes this producer webinar, and a webinar on the livestock industry's role in an emergency operations event center, which includes an overview of the incident command system. Ron Barker is our project advisor, and Amanda and Sarah offer editorial and graphic design support. This slide features some industry feedback on the AHEM resources, including the industry staff plan and the producer handbook, the incident command system presentation that I just mentioned, and the disease recognition and response training for private practitioners. We'll discuss these more in detail later in the presentation. Now I'd like to turn the webinar over to Gina, who will take us through this introduction to a serious animal disease awareness workshop and demonstrate how the producer handbooks can guide you through preparing for and responding to a disease outbreak. Gina?
Well, thanks for the introduction, Mickey. I'd like to set the stage for this part of the presentation by just letting everyone know that the simple truth is that government does not have the capacity to manage all aspects of the livestock industry's needs in a serious animal disease event at the best of times. Were a serious animal disease outbreak to occur in the livestock sector during COVID-19, for example, it would be much lower priority for the government than the current pandemic in the human population. By building awareness and capacity amongst producers and associations, the AHEM project is helping industry to help itself through undertaking proactive steps and providing guidance in the event of a serious animal disease outbreak or other emergency event. This webinar is part of that training. We like to call our resources industry first aid for producers. AHEM's producer handbook and commodity association staff plans, and you can see some examples there on the slide, and national frameworks contain the same principles and components regardless of the commodity or province. This helps to ensure the consistent application of the protocols across commodities and across provinces in the event of a serious animal disease outbreak across sectors. Importantly, AHEM resources also fit with government's plans nationally and provincially with Ag Canada and CFIA. We're not trying to plan for every possible eventuality, but the idea is that if we all know our role and responsibility and how to work together from a plan and a handbook, we can practice and perform well in any incident or event. So why do we need to be prepared for an emergency? Well, as we see here, outbreaks in the livestock sector do happen. This OIE map of disease outbreaks in a given period is making the point that foot and mouth disease and other diseases do happen in countries that were previously free of the disease. Canada's livestock industry is paying more attention to this than perhaps ever before, with African swine fever in the pork sector and foot and mouth disease for its multi-species and sector impact and higher infectivity due to its aerosol spread. The reality is that Canada has most of the factors found in research to be associated with very large outbreaks. For example, we have high density. Think of Feedlot Alley in Alberta. We have long distance and high frequency movements. For example, our trucking with so many wheels on the ground at any given moment on any day. We have commingling. Think of the use of auctions and pre-sort sales. And our business model features an inconsistent application of biosecurity within and across species. We see here the market impacts of serious disease outbreaks in agriculture. I want you to note the $58 billion estimated impact of a foot and mouth disease outbreak in Canada's livestock industry. African swine fever, as we know, is a hot topic of concern in Canada's pork industry, and rightly so. Should African swine fever be detected in Canada, the Canadian Pork Council said we can expect the loss of export markets, which account for 70% of pork sales, a crippled $24 billion sector, an estimated economic impact of $50 billion on the Canadian economy, and a major impact on Canadian pork's reputation. Here's what a $50 billion impact looks like. Here's how these possible impacts would really hit home. 79,000 livestock operations, 2.3 million jobs, and this probably feels a lot more real now under COVID-19. Recall earlier this year, the bottlenecks in the agricultural supply chain due to the ripple effect of the pandemic arriving in Canada. The recommendations and orders to stay home and the closure of sit-down restaurants immediately impacted the food retail and food service industries. Demand dropped off for dairy and protein products, and the chronic labor shortages in agriculture were impacted further still when workers at large processors fell ill. And that caused backlogs, slowdowns, and closures. The impacts were largely what to do with the animals that can't get to market as planned. Well, this is what AHAM's resources are designed to help mitigate by building awareness, understanding, capacity, and sustainability. And you can see here the areas we work in, the protocols, training, and additional resources. We'll talk more about the protocols on the next slide. So industry protocols for policy gaps. Industry and government, through a number of exercises, have established that there isn't a clear policy in the areas you see here on the slide. Yet industry requires policies in these and several other areas. These are examples of the work currently in progress. Voluntary cease movement in the early days of an outbreak. What to do with the animals in transit. Vaccination, is that vaccination to live or is that vaccination to die? And depopulation. These are areas where we know industry will play a role and we have to define what that looks like. On the second point, that includes frameworks, plans, and handbooks. We've already worked with 15 provincial organizations providing plans and handbooks. We're going to work with another 15 provincial organizations and 3 or more national associations on national frameworks. The work on the national frameworks is ongoing with the Canadian Cattlemen's Association, the Canadian Pork Council, and Dairy Farmers of Canada. By project end, we expect to have 75% of the livestock industry on the program. That's our program, which means a consistent, aligned approach across commodities across Canada. On the third point, awareness includes workshops in person or virtual, like we're doing here today. This introduction of our popular producer awareness workshops is based on the handbooks. These workshops are available in a multi-species or on a commodity-specific basis. As Mickey mentioned, we also offer an overview to the incident command system for association leadership and board executive. ICS principles can be used in an emergency operations center or EOC. The EOC is where industry may become involved in a large-scale emergency event. On the fourth point, of course, preparedness includes ensuring Canada's veterinarians have access to the latest disease recognition information. We've already offered FMD training online for this group, and that wrapped up in June, and we had a tremendous response. Online training for African swine fever is in the works, with a launch date in winter 2021. A key feature of the Producer Handbook resource is this chart, which outlines the key steps of a serious animal disease event. Having come from an industry association background, I can honestly say that I wished I'd had this chart in my hands when dealing with emerging events, because it really would give producers avenue to see what they can be doing maybe on their farm and really an idea of what may come if suspicion turns into a real event. So again, the chart really enables producers to take proactive steps on their farm the instant they learn of an alert and in that space until a confirmation is declared by following the protocols and guidance set out in the handbook for each phase of an event. And you see the little star there on the second point under response about investigation and tracing. It's really about traceability. A lot has been said and more will be said both here and in other industry meetings. Traceability is important. It's hugely important. It impacts a lot of things, from initial rapid identification of immediate contacts right through to impacts on the industry and impacts to producers. A similar argument could be made for biosecurity. Anyway, I think COVID-19 has helped everyone understand the general concept of traceability and its role in disease management and containment. In the human pandemic, contact tracing is key to slowing the spread of COVID-19, and it helps protect you, your family, and your community. And just a note on mental health awareness, AHEM includes a mental health resource in the plans and handbooks. Canadian Mental Health Association data shows that 1 in 5 adult Canadians will experience a mental disorder in their lives. This figure translates into 4.5 million people. But what do we know about the prevalence of mental health in ag? I mean, farming is said to be one of the world's most stressful occupations. Well, a 2016 survey from the University of Guelph showed that 45% of farmers surveyed said they had high stress, and 35% said they had depression, which is 2 to 4 times higher than farmers studied in the United Kingdom and Norway. 40% of respondents told researchers they would not seek counseling due to the stigma associated with mental health and illness. The bottom line is that there's a correlation between mental health and animal well-being. In trying times, it is important to monitor your health and the health of those around you to ensure everyone is coping with the situation in a healthy way. There is help available. Check the animalhealth.ca website for links. So just a little bit about the scenarios we provide in our producer awareness workshops. The workshops are usually 3 to 3.5 hours long. So again, this webinar today is providing you with an overview. Again, these exercises are explored using the producer handbook as guidance. The workshops are an excellent tool that spark tremendous engagement and spur many questions. We do emphasize that these are scenarios. We have in the workshop setting had people become so involved in the scenarios and sorting them out that they actually became convinced that they were real. So we do sort of seed the presentation with notes that this is just a scenario, but I think that's probably a good, gives you a good idea of how realistic these can feel when you're working through the scenarios. So in our work, we are partnering with all commodities. That's pork, beef, dairy, sheep, and goats, small lot producers, so primarily hogs and sheep, horses, and soon bison. The small lot producers are difficult to reach as they typically are not connected with the commodity groups, and they may not be aware of industry information and alerts. We generally use foot and mouth disease in our scenarios as it's a concern and a direct risk for all commodities. We have developed workshops that focus on just one disease of concern to a specific commodity. So here's an example of one of our scenarios. Let's go through the slide and read it together. This is a Atlantic Canada slide, so we do regionalize these as we go through the presentation. So Martha and John operate a small mixed farm in the Kings County area in PEI. First generation back to the land farmers, self-described natural and organic production systems. They have 20 sows, offspring and product are marketed locally, 18 weaners and 2 cull sows shipped last week to 4 different destinations. And you can see the destinations there. One is a heifer replacement farm in the Sussex area of New Brunswick that supplies several large dairies in the Atlantic provinces in southern Quebec. They have 50 beef cows and 2 bulls, which they describe as largely a closed herd on intake, and they shipped calves last week to 2 auctions near Truro. Their animals are sick. They found a vet and called him because the situation is worse, and when the veterinarians get on scene, they learn that Martha and John have 2 homestay English as a second language students, and one returned from China 2 weeks ago, having attended a wedding on her uncle's farm. Now, this is obviously a pre-COVID scenario, but this is pretty typical of what might be happening. So you can see there's a lot going on in the slide, and you can see that there's a potential for a whole lot to go wrong. A lot of Eastern Canada is potentially implicated in this scenario initially. In a workshop setting, we ask a few questions about their farms, operations, and break into discussion groups. We ask things like, if this is African swine fever, and it's been here for a month with all the movements on and off the property since then, or what if it were foot and mouth disease, which of course is more contagious still with its multi-species impact? How many farms would have been exposed, actually touched by an animal, a person, a vehicle that's been in contact with this premise? Think about your operation. What do daily movements look like there? I mean, these types of questions are really meant to get you to think about the daily movements on your farm and what that looks like. Here's an example of some more questions that we use. And they're really designed to get you thinking about your place, and they're particularly relevant for those running multi-species operations. A few months ago, we asked the Hutterites about movements on their properties, and that was a real eye-opener just because they have so many different commodity types on their large operations. So as we go through this slide, I'll just draw your attention to that third question there. And, or the last question, most workshop participants answer no to that one. Further, I will add that we're not, and we probably will never feel ready. That being said, that there are many initiatives underway, including ours, that are all contributing to a more prepared industry. And that's a good thing, since an earlier survey indicated that this was widely recognized as the industry's greatest vulnerability. Here we start to connect the scenario to the handbook resource. Looking at the scenario, what is the information you as a producer would be wanting to review? So we've got CFI declares an infected place on suspicion, the premises is quarantined, visitor logs are requested, traceouts begin, and identification of direct contacts. Movement controls on specific properties are put in place, and direct contacts may be quarantined. CFIA informs provincial vet, and so on. Media reports of an outbreak. Livestock associations advise producers that something's up in general parameters only, and they advise, review and heighten biosecurity, review preparedness. That's probably how this situation would roll out. But again, there's an awful lot going on in this slide, and remember, it's just on suspicion. So I think you can see the value in having a reliable resource on hand to help you through, especially the last points here on reviewing and heightening biosecurity and reviewing preparedness. And just, while AHAM resources are industry first aid, the reality is that 99% of other farms aren't going to have the disease, but they are going to be significantly collaterally impacted. So how will you continue business operations in the context of a suspected disease outbreak ongoing in your community and or in your region? A lot of our producer handbook is geared towards keeping the wheels on the bus for the other 99%. How do we do that? We are going to help you by helping the infected farm to recognize that there is an unusual animal health event happening on the farm. For producers in the suspect areas, we've got a lot of information and the proactive steps to preserve business continuity. So for example, if you learn that a serious animal disease is suspected to exist, you can take a look at this Notice of Suspicion Response Protocol in the AHAM Producer Handbooks. It tells you where the information is coming from, if it's in an area that's of risk to you, so your trading area or what have you, and the rest of the triggers here, is the information coming from federal, provincial vets. It also tells you under producer response what you should be doing as a result. So things like implementing elevated biosecurity, reviewing high risk biosecurity, monitoring CFIA, provincial government, and association websites for updates and so on. Here we have the Unusual Animal Health Event Indicator Protocol and the Unusual Animal Health Event Initial Response Protocol. The indicator protocol helps you understand what would indicate an unusual event on your premise. For example, a sharp increase in sickness, animals backed off feed, those kinds of things. I mean, so often we realize after the fact that we may have totally missed the trigger that suggested something was wrong. The initial response protocol provides guidance about the steps to take if an unusual animal health event occurs on your premise. There are 4 points there. Notify staff and family members and ensure others on premise are aware. They may have related information. Call your veterinarian and follow their recommendations. Identify a primary contact within your organization to act as a point person and be available for key decisions. And contact external stakeholders. So typically this would be a farm vet notifying the regulatory authority if appropriate. So in terms of biosecurity, we've imported from the national biosecurity standards developed by each sector, generally with CFIA involvement. That's the green or normal information. We've suggested elevated or amber and high or red risk protocols. The industry as a whole has a lot more to do here, and we'll update this part of the resource as it comes. Just to note that all AHAM resources are living documents. We update them to contain the latest information. The printed plans and handbooks in the binders are really first generation. The latest versions are always online in PDF format, and we encourage you to visit animalhealth.ca for those updated versions. This voluntary cease movement protocol is an earlier generation. It sets out how it works, etc. What we're adding in is the trigger, who calls this, what's included, what's not, and the exceptions. And we're also adding a separate protocol for animals in transit at that moment to and from your premise. So this is a really good example of why we update these. This is need to know information that you need to have at the ready at crunch time. Also, some of these protocols may be renamed to stay current with government nomenclature. For instance, the term voluntary cease movement may be changed to non-essential movement ban. Stay tuned, that's to be determined. Here we're looking at the different zones that can be applied in a serious animal disease event. There are going to be movement restrictions and you will have to abide by them. That's really the point of this slide in the workshop. There will be some restrictions in the orange or mustard zone and very restrictive constraints in the light red and dark red zones. We customize the zones to the provinces and go through the restrictions per zone in detail in our in-person workshops. This is really an example of what a zoning strategy could look like. This one is more for beef. The differences in zoning really have to do with the disease types and transmission. In pork, African swine fever is not as highly transmissible as foot and mouth disease just because of the way they spread. And just a reminder that implementation plans and procedures that are specific to the disease, the event, and the location will be provided at the time, and they may differ from the information presented here. So looking at this scenario, mass vaccination and depopulation, we know it may be ordered by the minister under the Health of Animals Act. We know it's an essential disease control measure and part of our international expectations under the OIE. You can see the mass vaccination, there's a specific way to do it and it will be supervised, and same with depopulation and disposal. And you see that note there, who is depopulating the various operations involved, and we'll talk about that in a minute. But looking at this scenario, what is the information you as a producer would be wanting to review? We have protocols that contain basic information for vaccination and for depopulation. So back to that note about who is depopulating the various operations involved, recall at the start, I said government does not have the capacity to manage all aspects of the livestock industry's needs in a serious animal disease event at the best of times. The truth is that producers and industry staff may be called to assist in these areas, and that can be the act itself or the provision of movement permits or licenses as requested by producers, or cleaning and disinfection. The producer handbook has a mass vaccination protocol. There is a prescribed process here, and it will be managed by a site supervisor appointed by the CFIA. Again, be aware of the impacts on the mental health and well-being of yourself and your staff. Resources are available. The producer handbook can act as a guide for you in periods of high stress, and it's best to familiarize yourself with it in peacetime and refer back to it often. Now let's take a look at the actual protocols on the next slide. So here we have the mass vaccination protocol and mass depopulation and disposal protocol. Protocols are necessary, whether vaccination or depopulation. And again, it's not that a producer doesn't know how to do this, but it must be done in a manner that can be documented back to the rest of the world later when CFIA is declaring our disease freedom and re-entering the market. The CFIA needs to be able to document absolutely everything that's been done relative to OIE requirements to rationalize our re-entry to their markets. So scenario 6, cleaning and disinfection. This is what you've got to go through to have restrictions lifted and to get back into business, and it must be done to the satisfaction of the CFIA in order to move forward. If not, a premises will continue to be designated as an infected place until these steps are completed to the satisfaction of the province or the CFIA. The cleaning and disinfection protocol is in the producer handbook. This is much more stringent than we would likely anticipate and probably feel is warranted. But remember, compliance is essential, again, for market re-entry. And the reality is that no infected premise will be allowed to restock before CFIA has signed off at certain steps and at the conclusion of the cleaning and disinfection procedure. So in conclusion, AHAM works in coordination with the provincial and national commodity associations, governments, and existing industry plans across the country to ensure a consistent approach to managing a major emergency event. Go online to animalhealth.ca/resources and download the latest version of the producer handbook and review it in peacetime. Ask your commodity association to host a scenario workshop or workshops to ensure all members experience the value of the scenario exercises and the producer handbooks. Help everyone on your operation understand, prepare, and respond to a serious animal disease event with confidence. And feel free to contact us and follow us on Twitter. The information's up there on the slide. Thank you very much.